Hi, my name is Cherish. I'm a nurse practitioner student, and I'm going to be doing a health history on you and ask you a few questions today. Is that okay?
Yes.
How would you like to be addressed?
As Mr. McLean,
And what are your pronouns?
he,
What concerns you today, or do you have anything specific that you would like to address?
no thank you.
So I'm just going to start with the history. Do you have any history of any medical diagnosis, chronic illnesses?
No,
Do you have any surgical history?
no.
Okay, so I'm gonna ask you a few questions about your family. So on your maternal side of the family, your mom's side of the family, is there any history of any cardiac disease, diabetes, autoimmune, cancers?
My mom's mom had cancer.
Okay. And then on your paternal side of the family, your father's side, is there any history of cardiac, diabetes, autoimmune, or any cancers?
Same, my mom had cancer too.
Okay. And what about your siblings? Do they have any history of any medical diagnosis or chronic illnesses?
No.
No. Okay. So I'm just gonna ask you a few questions about your personal life and your social life. So where are you from?
Cleveland, Ohio.
And what is your education level?
High school diploma.
Where do you work?
A group home, I do DSP, direct support professional.
And how often do you work a week?
About 40 hours a week.
Do you have any work-life stressors with that?
Sometimes.
Sometimes.
Not often.
How do you deal with that?
Maybe a lunch break, a 15-minute break, or for the most part, I just get through my shift, go home, clear my mind, come back the next day or so.
And what is your home life like?
Pretty normal. Video games, television, company over every here and then. Typical.
Do you live with anyone?
No.
And do you have any hobbies?
Yes.
What are they?
I enjoy playing basketball, being around friends and family, traveling, driving. That's about it.
Do you work out?
Yes.
How often do you work out?
3 to 4 days a week.
Okay. And is there a specific diet that you follow?
For the most part, I don't eat. For the last 3 to 4 years, I haven't been eating beef or pork. I try to keep it seafood, turkey, chicken, and that's about it.
And how's your appetite?
It's pretty big.
Okay. No trouble eating?
No.
Okay. Do you drink at all?
No.
And do you use any tobacco products?
No.
Marijuana?
No.
Vapes?
No.
Any recreational drugs?
No.
Do you take any prescription drugs?
No.
How about herbal supplements or
No.
vitamins?
One a day vitamins?
So just a multivitamin?
Yes.
Okay. So what do you do for self-care?
Self-care. I might go for a jog, a walk here and there. Home workouts, push-ups, sit-ups, anything in that nature. That's about it.
Okay. So do you have any trouble completing any of your daily activities?
Unless I'm just being lazy. Other than that, no.
Okay. So are you sexually active?
Yes.
And do you use protection against STIs?
Yes.
And do you have any problems sexually?
No.
Do you have any children?
Yes.
How many?
3.
3.
Yeah.
Okay. And so now I'm just gonna go through a review of your different systems.
Okay.
More questions. So how are you sleeping?
For the most part, I sleep fine. I might sleep too much, but I do that. That's a me thing. I do it on my own.
Okay. Do you have any pains or anything that's bothering you?
No.
Any new or old rashes?
No.
Any like odd skin pigmentation that you've noticed?
No.
Do you have frequent headaches?
No.
What about dizziness?
No.
Have you ever had any syncopal episodes like passing out?
No.
Blurry vision?
No.
Double vision?
No.
How often do you see an eye doctor?
I haven't seen an eye doctor in a long time.
A long time.
Yeah.
Okay.
I got a good eyesight though.
Okay.
Yeah.
Do you have any ringing of your ears?
No.
What about any loss of hearing?
No.
No. Okay. What about do you have any sinus pains?
I have allergies. So,
Allergies?
Yeah.
Okay. Just like seasonal allergies or?
Well, it's seasonal, but they can. Seasonal. We say seasonal.
Oh,
Like
okay.
summer, spring, like with the pollen and all that.
Okay. Do you have allergies? Anything else?
No.
No. Okay. What about? Do you have any like frequent colds or constant nose running?
No.
No. Okay.
Maybe 2 coats a year. Yeah, 2 coats a year.
Okay. And have you had any like bleeding of your gums or
No.
pain in your teeth?
No.
When was your last dental visit?
About 7 months ago.
Okay. And do you keep up with that?
Yes.
Okay. Do you have any trouble breathing, shortness of breath,
No.
chest pain,
No.
chest tightness?
No.
Any heartburn?
No.
Nausea, vomiting?
No.
Have you had any like increase of urination, increase in thirst, anything like that? No. Okay. How about when you urinate? Do you have any pain with that?
No.
No. And do you have any like dark, discolored, or bloody urine?
No.
Okay. Do you have any joint stiffness?
No.
Muscle aches?
No.
Any swelling you might have noticed?
No.
Okay. Do you have any numbness, tingling anywhere?
No.
Have you ever had any like loss of memory or trouble remembering things?
No.
Okay. Do you ever feel anxious?
Yes.
Yeah.
Yeah.
Okay. And how often do you feel anxious?
Depends on the situation. I could probably get anxious daily, but not often because situations don't come up to where I need to be anxious, but pretty anxious.
Okay. Do you do anything specific to deal with that?
Maybe rush, but that ain't.
Okay. Are you easily irritable?
No.
No. Okay. Would you say you're fairly happy with your health?
Yes.
Yes. Okay.
Yeah.
So we went through this different systems. Is there anything else that you would like for me to know?
No, thank you.
No. Okay. Well, it was nice to meet you, Mr. McLean.
Nice to meet you too.
Thank you.
All right.